Juliana Ome is the name. Caesarean section myths and truths is the topic. Caesarean section is fondly called C-section or CS. It is the delivery of a baby through an operation done on the abdomen of a woman once a baby can survive outside the womb. In some parts of the world, it's when the pregnancy is from 28 weeks of age and above, while in other parts of the world, a baby can survive outside the womb as early as 24 weeks. So what this means is that CS can be done before 9 months once there's a need for it to be done. CS is one of the oldest and commonest operations done for pregnant women, and it dates back to the ancient times as early as 715 BC. Now, what is the reason for CS? It can be from the mother or from the baby. Conditions from the mother will include cephalopelvic disproportion. Cephalo means head and pelvis means the hip bone. So when the mother's hip bone is too small or the baby's head is too big, even though the hip bone size may be normal, it is called a disproportion. So the baby cannot pass through to come out vaginally unless you want to reduce the head of the baby. And the baby will die if you try that. So to solve the problem, you have to do an operation for the mother, and that is CS. And everybody is happy. Mother and baby are alive. Another one is placenta previa, especially the type called major degree placenta previa. This is a condition where the placenta is completely blocking the opening of the womb. Baby cannot pass to come out. So you have to take the baby out through cesarean section. Also, for a woman who has done CS for 2 times or even more, she will have to go for CS again to deliver. A woman who has done CS once and then the current pregnancy has other problems, like a baby coming with the buttocks instead of the head. This is called breech presentation with a previous scar. Then when someone has had previous preeclampsia or diabetes in pregnancy, in a particular pregnancy after CS the first time, that's a complication, so the person might need CS. Then when the doctor tries to help deliver a baby with a special instrument called vacuum extractor or a forceps, and this one fails, the next thing to do is CS so that you can save the baby. Then when the woman in labor cannot complete the process of labor because of any reason at all, this is called obstructed labor. You have to help the woman so that she doesn't die in pain, please. Meanwhile, the topic obstructed labor has been well explained in a different health talk on my channel, so you can watch it and learn. Also, if a woman has had a cure for an injury between her bladder and vagina, this is called vesicovaginal fistula, she will have to deliver by CS when next she wants to deliver. This is also available on my channel. If a woman has done an operation on her womb in the past, for example, she has done fibroid operation, she may likely deliver by CS, although not in all cases. Also, if the placenta separates and the baby is still inside the womb in the first stage of labor, now the placenta is what supplies the baby oxygen and nutrients inside the womb. So if it pulls out, it means baby may suffocate because of lack of oxygen. So when this happens, CS is the way out. When a woman's blood pressure is too high with protein in her urine during labor and her womb is not yet opening well for baby to come out, this condition is called unfavorable cervix with severe preeclampsia. CS has to be done. Else, the woman may convulse, and this is eclampsia, and so many women have died from it. Then, of course, when a woman comes to deliver in the hospital, and you know that she has cancer of the cervix is the mouth of the womb from where baby will pass through during the vaginal delivery. So a woman with cancer in that part of her body cannot deliver vaginally. She will need operation. Sometimes HIV positive mothers too will also require CS to help protect their babies from contracting HIV. Then when there is serious infection like herpes infection, to protect the baby, the woman may need CS. Then are conditions from the baby. When the baby is not breathing well and labor is just starting, this condition is called fetal distress in the first stage of labor. If you leave that baby to face the stress of labor, that baby may die, and 9 months would have been a waste. So CS should be done. If the umbilical cord comes out first before the baby, this is cord prolapse, and the baby is alive in the first stage of labor, the best thing to do is CS. Then transverse lie. This is when a baby is lying horizontally inside the mother's womb. There's no way the baby will jump out through the vagina lying this way, so that baby has to be taken out through CS. Then a first-time pregnant woman with a baby coming out with the buttocks. This is breech presentation in primary gravida. It is an indication for CS. Then other abnormal presentations like baby coming with the forehead, brow presentation, or coming with the leg. you have to bring out the baby through cesarean section. Then when there are multiple babies inside the womb, like 2 babies or more, CS. Then of course, when the baby has some abnormalities, like maybe too much water in the head, hydrocephaly, CS is done. Then when there's maybe conjoined twins, babies joined together, CS has to be done. When the baby is extremely small, like a birth weight less than 1,500, CS has to be done. Now, what are those myths surrounding CS? Number one, they say when you deliver by CS, you're not woman enough. It is not true. We have looked at the reason for cesarean section. These are all capable women. In fact, there are even more women than you can imagine. So you're woman enough if you have to go through CS. Number two myth, they say that CS is for lazy and irresponsible women. Please. Caesarean section has nothing to do with your capacity as a human being. It is a medical procedure for medical reasons. So, number three, they tell you that CS is not for Hebrew women. So, as a believer, you can't go for CS, because if you do, it means you don't have faith. So, you're not a Hebrew woman. Now, you have seen the reasons for CS, right? I know that CS is a good thing because it saves mother and baby at delivery. So, please, as a believer, you go through CS. You're still a believer. I don't think if a woman does CS to deliver her babies and she stays alive to a ripe old age, when she dies, maybe at the age of 90 years, and she gets to heaven, God will tell her she did CS, so she can't enter heaven. Please, in all you're getting, get understanding. Remember what the Bible says, that my people perish for lack of knowledge. Dear Christian women, if the doctor tells you there's a need for CS, please, with the knowledge you now have, sign the consent and go for CS and stay alive to perform all the work your Creator has given you to do for Him. Many women have lost their lives trying to be Hebrew women. Hebrew means mother and baby are alive. Biko. CS is a Hebrew birth. You know what? Get to watch the talk I did on Hebrew women, alive or dead. It's on my channel, and do well to share to all your friends so that they will learn and take the right decisions. Meanwhile, I will attach all the links for these health talks I've been referring you to at the description box of this particular health talk so that it will be easy for you to access them. Then number 4 myth, they said you must be put to sleep for a CS delivery. It is not true. In fact, most times the mothers are awake and they are even conversing with the doctor as the doctor brings out baby during CS, and they see their babies immediately the babies are delivered, because there's a procedure done for them called spinal anesthesia and not the general anesthesia, where a woman is put to sleep, except on few occasions when there's a need to put the woman to sleep. Then number 5, they say you can't breastfeed your baby for days after CS. This is not true. Once you're strong and you're out of pain, you start breastfeeding your baby. Number 6, they say you'll be bedridden for days and you're unable to work for days after CS. This is another myth. 24 hours after CS, most mothers are out of bed unless there's a complication. But all things being equal, you're out of bed, you're walking around, taking oral feeds, and breastfeeding your baby, and then you're fine. After a few days, you're discharged. Number 7, now people say you cannot have a vaginal delivery again after you've undergone CS for the first time. Please listen to this. If you have gone through CS for only one time, you can have vaginal delivery. It is known as VBAC, vaginal birth after cesarean section. Number 8, they say in your next world you have a scar on your abdomen. And there is nothing like that. If not, some of us that have helped women deliver babies in labor room, we've seen so many female babies with scars on their abdomen. Number 9, they say that CS is a painless delivery. It's not true. CS is surgery, agreed. You will not feel pain during the surgery, but when you are recovering, you will feel pain. No? So it is not totally zero pain. There's pain at some point. Then number 10, they say you have failed in your duty and your husband and family members are not proud of you. Please, this does not hold water. How can you even say that? Please know that if you deliver by cesarean section and you are alive and baby is alive, your husband will be so proud of you. In fact, he will take you out and buy you a new car. Because you made it. So please. Now, there are so many other myths. Just use the comment section and let me know the additional myths you've heard about CS. Now, let's look at some questions that mothers ask about CS. Number 1, can I choose CS as a form of delivery? Oh yes, you can. It's called elective CS. Meanwhile, discuss with your doctor on your reason for the elective CS to be sure there are no other ways of handling your concerns. For example, if the reason you want CS is because you don't want to experience the pain of labor, no need to do surgery. You can go for the option of epidural delivery. Epidural is a painless delivery where an injection is given to the woman in labor to make her not feel any pain at all, and she'll be chatting on her phone or reading her ebooks on her tab while waiting for her baby to come out, conversing with her husband while waiting for baby. Number 2 question, I have delivered 2 CS. Can I ever have a vaginal birth? Yes, darling, you can. Of course, I have mentioned earlier, there's something called VBAC, vaginal birth after cesarean section, but on one condition: if the reason for your initial CS is not a recurrent reason. A recurrent reason is something that's happened in one pregnancy and can happen again. For example, when a mother's hip bone is not wide enough for a baby to pass, it is called contracted pelvis. And of course, the woman is not growing anymore, so the hip bone cannot grow. In this condition, the woman may require CS to deliver her babies anytime she needs to deliver, because it is a recurrent reason. Number 3 question, what if I am brave enough? Can I try vaginal birth? Then if it fails, I can do the CS that doctor recommends. To answer this, I will say, why go through the pains of labor and allow your condition to be declared an emergency before you go for the CS? And also, the likelihood for your baby to develop some complications will be high. The baby may even be in distress, not breathing well, by the time you have tried normal labor for too long. Now, this is one reason most mothers go to TBA home, who will promise them a normal delivery despite the advice of a doctor. And some of our dear mothers do not survive to tell their stories. A man once narrated a story of how his wife died in a delivery home after the doctor told them that she would require CS, but the wife went to a delivery home where all women must deliver vaginally. But in the course of her pushing, she started bleeding heavily and she died. A lot of women have died this way. Please don't be a victim. Go to the hospital. Number 4 question, my husband must sign a consent for me before I can undergo CS. If he's not around or refuses to sign, what can I do? Now, some persons will be surprised to hear this question, but it is the reality of some women, especially in the developing countries of the world. Please, the solution to the issue of signing a consent is the birth plan. A birth plan is a step-by-step document to prepare with your partner and your midwife or your doctor on how you want the processes of childbirth to go and the kind of delivery you wish to go for. So your husband, or girl will sign before delivery time while you're still pregnant, so that you can sign for yourself, or he can just document and say that anyone can sign so that you can have your babies. Mothers, wake up. Get the right knowledge. Stay informed and stay alive. It is your right. Go to your doctor, nothing short of it. Before I end this particular session of a health talk, I want to praise all the women out there who have willingly embraced the option of CS. Thank you so much for taking that decision to stay alive. And then if you are being a victim of a TBA home and you stayed alive, congratulations, and please share your experience with others and encourage them so that they don't risk their lives. Thank you very much for staying to learn. I am certain that after this health talk, you will know that CS is an operation a woman should go for once there's a reason for it, and she will come out safe, and her baby is also safe. Hebrew woman, yes please. Once again, Juliana Ome at your service. Do well to subscribe. Encourage me with your subscription. Click on the notification bell so that you'll be notified on subsequent uploads. Share my videos on all your platforms so that everyone will get informed and make the right decision. Thank you very much, and see you again.